Good morning, everyone. Has everyone had their coffee and bagels and everything and ready to go? All right, so we're going to jump right in, and we are going to talk about a lot of tools that are here at the university that are available for you guys to use to help your research and help it get it going. First tool is REDCap. I am the REDCap queen around the university, and I love REDCap, so we're going to jump right into it and talk about it. What is REDCap? REDCap is a secured database. It is used to export. What do we export? Excel, SAS, SPS. We can export in data that's raw, and we can do it in labeled. We have so many features in REDCap. We can do auto-validation. Auto-validation is so important when you're exporting that data because we want to make good quality data, right? We can do branching. We can do calculated fields. How many of us want to be on the same calculation versus those couple days and hours off? There is no licensing requirement for REDCap. You have a membership here at the university, and guess what? It is free! Yes, you guys can all use it for free. REDCap is installed at over 2,000 installations, not only here in the States, but around the world. Think of the research you guys can do around the world, around the country. We're OSU, right? We're going to do this. We're going to be the next top thing. So why do we use REDCap? Well, it's web-based, so that means you guys can use it from anywhere. You guys can use it here, you can use it at home, you can use it in another country if you want. There's scheduling in it for you guys. It's going to help maintain keeping your patients on the schedule, making sure they're coming into the right appointments. There is no limit to the amount of response you want. I have a research team, and if you've ever heard this talk, I tell everyone that they have over 300,000 participants in their REDCap database. Think of the data. Think of what you could do with that. It's just amazing. What about the number of questions? Do you think we have a limit? No. You can have as many questions in your REDCap database as you want, or as little as you want. No limit. So we have two instances here of REDCap. We have a PHI instance, which we put behind the medical center firewall. Then we have a non-PHI instance, which we put behind OSU firewall. Both of them are secured, but you can see that we are letting you kind of pick and create what you need. Access rights. Wow, this is one of my favorite things. You can have access, and you can have access, but I'm going to have different access than you, and you're going to have different access than them. We all have customized user right access, so not one person has to have the same access. So the biggest question is VPN. Has anyone heard of Duo yet? Raise your hand. I'm not letting anyone, everyone's talking to me. Great. So now we're getting away from those VPN tokens that we were all using, right? Now we're going to Duo. So now we can take our PHI that is behind that medical center firewall, and we can access that with that Duo. What about logging? How many people have the regulatory come back and say, why did you make this change, or why did you do that change? And we need to know what's going on. We can customize and do all of that in REDCap for you. We have data inputs, we have time trackings, we can delete, we can add, we can really customize. Well, that's why we use REDCap. But what can we do in REDCap, and what tools are available in REDCap? We have calendars, we have your exports and imports, we have your loggings, we have your file. The most important thing, because everyone can read this, is REDCap Mobile. Well, why is that so important? Because how many people are now taking their research and saying, hey, I want to go down to Appalachia, there's no internet access, but I want to complete these forms on a tablet or on a phone or something. Well, I'm going to take that tablet with no internet access, I'm going to go do that data collection, and I'm going to come back to an internet, a McDonald's, a Wendy's, whatever, and I'm going to upload that data. So now I'm managing to keep all of that data from those paper forms and keeping them in my database. Much cleaner, much better process. So how do I set this up? Well, when you're setting up your REDCap project, there's a list of types of questions you can have. We have text fields, we have note boxes calculated because who all wants the same BMI, same age? What about multiple choice drop downs? Signatures. Yes, you can do signatures in REDCap. Not with only a mouse, but you can also do it with your hand. It is allowing that patient to be more interactive on that. We can do file uploads. What about a video? Who wants to teach their patients how to stretch properly? Who wants to tell their patients, oh, you need to make sure that you're eating this food and these foods? We can do that in a video for those patients, so we're educating our patients as we go through. When your data input, we want to make it as clean and as simple as possible. These are examples of what the data entry form will look like. REDCap allows 2 types of data input. One is through your basic data entry form, and your other is through your survey. Exporting. Okay, you guys have worked so hard on getting all of your data imported. You don't want to have, just this data sitting out there, so how do we get it exported? Well, REDCap allows you to create not only custom reports, but now you can take those reports and you guys can make graphs out of them. How many people are like, have to put a poster together tomorrow and are like, oh, I need a graph on that age. I don't know what it is, the sex or the age. That's already available for you. It's in there, you can pull it right out. As you can see, I have listed all the different exporting tools that are available for you. The most important thing though on this is that you can de-identify. Well, when I go into export, I don't have to go through and cut out all the people's identifiers and make sure I didn't miss anything. It will automatically do that for you. So that way I can go share my data with another institution if I want. Shared library. Well, I did tell you guys that REDCap has over 2,000 instances, right, across the world. Well, why should we repeat our work? Why do we have to redo what has already been done? So REDCap has taken the privilege of creating what is called a shared library. You can go in there and look up all your questionnaires and see if they're in there. Wouldn't it be great if you took a 36-question questionnaire and it took you a minute to make it? It's there. We're not trying to duplicate the work. We want to make it nice and easy and user-friendly. Online training. Well, I'm available for training all the time. I promise I answer my emails all the time. But when I'm not available at 2 in the morning, this is where you guys are going to go. You guys can do the videos, but there's a little trick in this. Not only are there videos, but if you click on the actual training, you can actually pull up a PDF. So you don't have to wake up the kids at 3 in the morning or 2 in the morning. You can actually read through the PDFs. So I do have a hands-on training, and I do talk and jump and joy with all this because I have lots of colors in my REDCap databases. But our first hands-on training is going to be in October. If anyone wants to come, learn how to do their own REDCap, set their own REDCap projects up, and start working on them themselves. In the advanced training we have in November, well, that's where we're going to have a lot of fun. We're going to get you into calculations, we're going to get you into branching, but we are really going to set that database up to where it's user-friendly and it's what you need. Well, now that I've told you about this great, great service, how do you get access to it? That's the big question. Everyone, has anyone heard of CORE? Everyone raise their hand if you've heard of CORE. CORE? Oh, not even half. So CORE is called researchrecord.osu.edu. That is where you put your research projects in and you request REDCap. Once you request it, I will set you up with a project, again, free, and you guys can start working on it right away. All right, so that was my fun with REDCap. So now let's jump into I2B2, another great thing I have for everyone. And we're going to talk about, well, let's take advantage of this data that's already there, right? So what is I2B2 RDR? RDR is a research data repository. It is a coded limited database. So we are setting you guys up that is extracting data from the information warehouse. Did anyone know about this? I bet you not many of you guys did. It is IRB approved to interact in a flexible framework that allows self-cohorts. Well, what's that mean? It is giving you guys access to extract data on an aggregated number of accounts. Well, who can use it? Anyone that's not a student, you have to be faculty or staff, and you have to be affiliated with one of the 7 schools. So if you are not in that criteria, you will not be able to use I2B2. But everyone in here fits it, so we're going to use it and we're going to have fun with it. Yes?
Can I get a show of hands for everyone who knows what the information warehouse actually is? I just want to make sure. So about half the room. So what the information warehouse is we have the IHIS system. It's our electronic medical record. People are treating patients and collecting data constantly throughout the workday. Every 24 hours, we push data into a SQL database. SQL is very similar to Excel with lots and lots of spreadsheets, thousands. And every 24 hours after that, it goes into our information warehouse. And at that point, we can actually access that data and export it for use. So once a week, we take that large accumulation of data, we push it into the I2B2 system. And so I2B2 is updated once a week with the latest counts for our patient database. Thank you.
You are so welcome. Thank you. So the RDR is the ability to perform self-service queries over a limited data set. Okay, so it supports increased numbers of research applications. Well, what's that? So when you guys are having your, trying to figure out how many people that you see with this actually code, the CPT code or this diagnosis code, and you want to know, am I seeing enough people to actually do a research project on that? That's where we're going to use this RDR to actually go in and see if we actually have those numbers. It helps minimize administrative burdens with those. It enables cohort discovery, and it provides access to those aggregated data points. So researchers will be able to identify those numbers. So when I say those aggregated numbers, you guys, it's strictly numbers that you're getting out of I2B2. So what is I2B2? And it's very listed out for us all, but it is a computerized framework that enables biomedical researchers to use existing clinical data for discovery. It was funded by the NIH. It's a roadmap of National Centers for Biomedical Computing. It is established in 2004, so we are not the only institution that has I2B2. It has over 49 CTSA sites that have I2B2, over 34 non-CTSA sites, and 20 international institutions. So this is a huge amount of people that have access to I2B2. When we look at I2B2, it is a web-based application that allows you to do ad hoc queries, and it is visible. So this is what your I2B2 will look like. It does show your patient counts, and it actually will give you navigations. RDR data is available via the I2B2 ontology. So what can we get out of it? What are we going to be looking for? Your demographics, your providers, your encounters, your diagnosis and problems, your procedures, your laboratories, and medication. The biggest thing, though, to remember that ages over 89 will be presented to researchers as being greater than 90. So RDR Access and Security. So authorized OSU researchers, faculty, staff, and part of those 7 schools, and I will list them: dentistry, medicine, nursing, optometry, pharmacy, public health, and veterinary med, will have access to I2B2 if you complete the training. Well, what about the training? We have training that is available. Right now it's in person, but guess what, everyone? I'm making it electronic for you guys, so you don't have to come to trainings for you. It is also utilized through the Active Directory. Well, what's that? That means that you have to have a medical center ID to access it. If you do not have one, that's okay. And you are part of those schools, we will get you a medical center ID. Well, how do you request it? You go through CCTS Informatics to register, and we will get you all signed up. Pretty soon, we will have this completed where you will be doing it through Buckeye Learn. You will look in Buckeye Learn, and it will set up the training for you. And I am all done, and Jeremy is going to do our IW data request. Thank you, everyone.
I always love it when we send Amy up first because she is much more bubbly than I am. She wakes up the crowd and really gets some great interaction. So before I jump into the RIW piece, we're going to try and do a slight live demo of I2B2 just so everyone can actually see how it works. So this is our I2B2 instance. And I'm logging in with my account. And so your given the navigator terms, your query options. So we're just going to do a very basic query where we're going to look at our ICD-10 codes, which I'm still adjusting to the ICD-10. And so we're going to look for diseases of the appendix. And we're just going to ask, how many people do we have with diseases of the appendix? If I click Run Query and say number of patients, I'm even going to say gender patient breakdown. It's going to take about 10 to 15 seconds to run this. And then it's going to come back and tell me how many patients within the medical center have this ICD-10 associated with them. So 1,530. And it gives me the breakdown of male versus female. We have a number of different options where we can set up with vital status, the race breakdown, the age breakdown as well. And so this tool really lets you start doing cohort feasibility analysis and all those questions for what should we say when we submit to grants. This can help with that as well. We really encourage you to take time to explore this tool and get trained on it. So jumping back, the RIW. So the Research Information Warehouse is meant to facilitate research-related access to data stored in the OSUMC electronic medical record system. So it's different from I2B2 in that we're actually going in, we're creating queries, going against the entire data model, and we're pulling back identified data that's specific to your IRB request. We can access the clinical encounters, demographics, finance and billing, clinical reports, radiology images. We have basically anything that's captured discreetly within the electronic medical record accessible and available for us to start looking into. So some of the different categories that we have for these requests, if you're doing preparatory to research requests, you need summary data. Sometimes I2B2, you have a more sophisticated query that you're asking, then it can be answered within I2B2. Most of those requests have now been farmed over to I2B2 because putting the power in your hands to build the queries for what you're exactly looking for has been fantastic. We do have honest broker research requests, so if you need this data de-identified, we can do it in a de-identified and a coded limited data requests. We act as third parties, honest brokers. You don't have to have an IRB so long as it's de-identified data, and it's retrospective data only. And then finally, we service IRB approved research requests. We deliver